Hi, this is Lori. I will be giving you my malignant hyperthermia simulation in the operating room tech talk today. Today's agenda will be learning about malignant hyperthermia, otherwise known as MH, how to simulate it without hurting anybody, responding like professionals, and not panicking. Malignant hyperthermia sounds like a villain. It's actually a genetic condition where anesthesia medications can increase the temperature of one's body. Malignant hyperthermia is an autosomal dominant genetic disorder that is triggered by certain anesthesia medications, with fatality rate of up to 90%, as quoted by some papers, and up to 5% mortality, even with treatment. What happens? This condition can cause a rapid rise in body temperature with severe muscle contractions that can lead to multi-organ damage as well as death. Therefore, it is very important for immediate recognition and treatment of this condition to prevent serious complications or death. The mHouse organization recommends administering dantrolene within 10 minutes of the recognition of a malignant hyperthermia crisis. People with mutations in the RYR1 gene are at higher risk for malignant hyperthermia. What are the common triggers for malignant hyperthermia? These include inhalational anesthetics and succinylcholine, choline, which are used in general anesthesia. It is very important to perform a thorough preoperative anesthetic evaluation, including family history, looking for malignant hyperthermia. Immediate intervention is essential for managing malignant hyperthermia effectively. One must discontinue MH triggering agents, increase inspired fraction of oxygen to 100%, consult with mHouse, administer dantrolene within 10 minutes of activating a MH code. Using effective management protocols can significantly reduce the risks associated with MH during procedures. Preparing for the simulation. Setting up a realistic simulation environment helps to enhance participant engagement. At our local VA, we perform operating room simulations in our ORs at 7 a.m. on days with a later OR start. Using the NVIDIA Omniverse technology, we can run simultaneous MH simulations at different locations around the globe, in actual simulation centers, as well as in virtual reality 3D simulation environments. To perform a successful simulation, we need to have monitoring devices, emergency medications, including dantrolene, in our actual simulation center or operating room, as well as in our 3D virtual operating room. Proper preparation, clear role designation, and the use of closed-loop communication all lead to better team performance during any simulation. Conducting the simulation. Please perform a thorough patient assessment, looking for signs of malignant hyperthermia like increased end-tidal CO2, tachycardia, and tachypnea. Fever can be a late finding. Early diagnosis of MH is key to ensuring immediate treatment. What are the immediate actions in treatment? 1, please stop the triggering medications. Administer dantrolene immediately after consulting with mHouse. Please use cooling measures like ice packs and Tylenol. Effective and clear team communication during a MH crisis simulation is very important for team success. Clear communication enhances response time in a crisis scenario. contributing to overall team efficiency. Critical actions and decisions. Administer dantrolene immediately after the proper preparation of dantrolene. Dantrolene is administered as a weight-based medication. Therefore, it is important to know the weight of the patient in number of kilograms. Admit patient to a monitored setting like the intensive care unit. Continue to monitor the patient's vital signs, including end-tidal CO2 and temperature, and redose dantrolene as needed following the medical advice of mHouse. Patients should continue to receive intravenous hydration. Thorough documentation of the events during the simulation is important for reviewing actions taken. Additionally, a debriefing session allows participants to discuss experiences and improve future responses. Documentation of the MH simulation training annually fulfills the Joint Commission's requirement for hospital-based MH preparedness. Evaluation and feedback. Using predefined metrics to assess performance during the simulation helps identify strengths and weaknesses. This assessment is essential for ongoing training. Gathering feedback from participants and facilitators provides insights into the simulation experience. Analyzing this feedback is key to making improvements. Continuous training and simulation refinement based on evaluation results ensure that the team is always prepared for a malignant hyperthermia crisis, improving overall patient safety. Performing a malignant hyperthermia simulation in the operating room is so important for preparing healthcare teams for this critical emergency. Proper training can lead to improved outcomes for patients facing this life-threatening condition. These next two slides show the references that were used to generate this tech talk. Thank you so much for tuning into this Malignant Hyperthermia tech talk.